So good afternoon, everybody. Today is March 18th, 2021, and we're here for the weekly COVID and vaccine update. And Ryan, um, before we started, I said that I believe that today is the anniversary date of um, the first confirmed case in Nevada County. Is that correct?
That is correct. That is, I believe it was around this time. I did not note that today was the anniversary of the first case. I will note that tomorrow is the anniversary of the statewide shutdown, and here we are still dealing with shutdowns a year later, and it's been quite a ride. And we've seen, I think, as I've said on other calls, the best and the worst of the community come out in this, and we're lucky to have on the call some people out of whom the best has come to get us through this pandemic. The medical providers and caregivers have just been heroes throughout this. So thank you, Dr. Evans, Dr. Kellermann, and Dr. Stevens. So yeah, it's a big and important anniversary, and hopefully we, when we mark the next one, we'll be in a much better place.
Not only in a much better place, but maybe we can actually have a town hall, an in-person town hall. Who knows? That would be pretty amazing. So, and I just got a message that Roger Hicks might be joining us too. Dr. Hicks might be joining us too for today. But while we're at it, Ryan, so things are really looking up as far as doses go. I mean, there's definitely progress. Can you just, in a nutshell, can you just update us?
Sure. Yeah, just very high level. According to the data that the state reports out, around 35,000 doses have been administered to people who reside in Nevada County. So that's great progress. And I think if you've been tracking these calls, you will have seen that number steadily ticking up. Around 66% of the people that have been vaccinated in Nevada County are over the age of 65. So we're making progress through that community who is, as I've mentioned before, we have doubled the state average in terms of the percentage of people over 65. So critical that we get to the most vulnerable people in the community. In terms of who's currently eligible, that includes people over 65. It includes healthcare workers. It includes teachers in childcare. It includes emergency services, and it includes food and agriculture. So all of those folks are currently being vaccinated. And then effective on Monday, Monday the 15th, that was opened up additionally to people between 16 and, or people 16 and up with underlying health conditions. And all that information on how that is determined is linked out on our website to the state's website. And so I encourage people to become familiar with that. And anybody that's eligible can sign up in My Turn right now, as well as access it through the other opportunities that aren't available through My Turn. So that's my brief update, and happy to answer any questions.
All right, thank you. And well, Dr. Stevens, how are things going at Chapa Day? And what was the year for you?
Yeah, I agree with everything that you guys are mentioning. Like, it's been a year, but we've learned so much through that time. We've changed the way we deliver care. We've actually increased access to care for people who've had transportation issues with telemedicine. We've just learned so much about how to stand up infrastructure for testing. So I do think that a lot of the things that we've put in place this year is going to help us in the future. But you're right, it's also shed kind of light to underlying health inequities, which is hopefully what we're going to be focusing on and rebuilding from here. So it's definitely a milestone today. I think we have a lot more answers today than we did back last March, and a little bit more hope with the vaccine coming. Even though the case rates are high, because we're vaccinating people, our hospital numbers have not gone up as much. I think Dr. Evans can kind of speak to that. And then in terms of Chapa Day, we are we do weekly clinics for vaccination, similar to the county, where 65 and up and 18 to 64 with those certain medical conditions. And that's all on our website, so please go ahead and look at that. We are only vaccinating our Chapa Day patients at this time because we're not getting huge numbers of vaccination allocations yet from Indian Health Service. We do have a drive-in clinic, which is a little larger, on March 27th that we're looking to fill as well. So if you kind of fit into that category and are one of our patients, please give us a call to get on that schedule.
And speaking of hospital, let's go down to Dr. Evans here. What's going on at Sierra Nevada?
Thanks, Pascal. Good to see everybody. So we have had, actually, our numbers of admitted COVID patients have been a little higher. They've gone up a little bit, and now we're just kind of trending around 7 or 8 patients in the hospital for the last week or so. So not a huge number, but every other hospital I'm aware of in our division is seeing declines in the overall COVID patient admission numbers. And we've kind of gone the other way. So, that has me a little bit concerned, although it could just be a little bit of just a little data blip. But I think we need to really continue to be very cautious about this moment in time. I'm sort of cautiously optimistic by the national numbers and the state numbers, but I also see a lot of businesses opening up, and I see a lot of folks that are starting to really relax their precautions, and that could be problematic for us. For me, this last year, there's been a lot of lessons, one of which has been the collaboration that we have with the county, with lots of different people in the community, with Dr. Stevens, Dr. Hicks, many other people, and how crucial that has been to a coordinated response to a pandemic. And that gives me a lot of hope for the future, just showing that we can sort of deal with whatever may come in a way that is much more collaborative than in years past. So that's been good. I've been a little bit alarmed by the realization that people are getting information from many, many sources now. And it's sort of different than the way things used to work before the era of social media. And I've been alarmed by how there are disinformation campaigns that seem to really take hold and essentially interfere with the ability of public health departments and hospitals and doctors to educate people and tell them what to do that can help save their life or just help the community be healthier. And so that's been a bit alarming. And I don't have an answer to that, but I think that, I've been talking with many different groups about how to vet information sources, which information sources to go to. How do you find out answers to complex scientific questions? Or simple scientific questions like, do masks work? Things like that. And I don't know if anyone has any brilliant solutions to this, but that has been a very significant take-home message from this last year for me, is just how do people get information? Are their information sources reliable? Are they accurate? And are they biased? Because we each of us need to figure out how to deal with that now that every single one of us, if we're on a computer or on a smartphone, has an individually curated news stream, which is based upon what we've clicked on before. And so we've got to figure out how to navigate that as individuals and as a community so that we don't have such divisiveness and mixed behaviors that are problematic when we have a problem like COVID-19. I'll get off my soapbox now and give it back to you, Pascal.
Okay, well, soapbox is free. Hey, Roger, Dr. Hicks. So a year in review, because it's kind of been a year, and what a year. So what's been the year for you, and where's YubaDocs at? What's going on in your shop?
Yes, it's been quite a year. It started out busy in January and February with the usual influenza and surge that we see every year. Then COVID hit, of course, and then we had, we started doing testing in March, and right at the early part when there was some question across the country of whether, is this really the role for urgent care? And I advocated strongly that it is. And I think that's, almost every urgent care in the country is involved with the pandemic, as they should be. Then we had our slowest month in 20 years in April. May was a little bit better, and then then it's just been super busy since then with testing and with vaccines, and with seeing COVID patients, either people we diagnose in the clinic or people who know they have COVID and come in because they think they're not doing as well as they should. Many of those we've referred to the hospital to have, well, recently, I mean, since it's become available, to have the monoclonal antibody infusions. I would say that one of the benefits for me personally of COVID is something that Brian mentioned, which is that every Friday morning since March, we've had a community physicians call. So the collaboration between community physicians, and also on that call, Brian and other people from this hospital, from Sierra Nevada, and also from Tahoe Forest, and our public health colleagues are on that call. So the collaboration amongst the medical community has never been closer, in my opinion, since the pandemic started. So that's one silver lining from a professional standpoint. Right now, our vaccinations, we're on pause with giving new vaccinations because the new third-party administrator for distributing vaccines is Blue Shield. We used to get them directly from the county. As of the end of this month, Blue Shield is the new third-party administrator for the state for distributing vaccines. And they so far have said that anyone who is not a Medi-Cal provider is prohibited from distributing vaccines, or from administering vaccines, excuse me. And we're not a Medi-Cal provider. I'm hoping that will change. I know there's a lot of pushback on many levels on that, and so I'm hoping that we can resume administering vaccines sometime in the very near future. I couldn't agree more with Brian about where people get their information. Trusted sources of information in the past, like, have been journalists, where sources are vetted, you know, for an article to be published in a reputable newspaper or reputable news source, there has to be, you know, verification through multiple sources. Medical science, there's peer-reviewed studies that are vetted and checked out by other scientists, other doctors, other researchers. And now we have a lot of people getting their medical information from social media, where there's no controls at all. So I am also very concerned about that, and looking for new ways and new ideas to have people rely on trusted sources rather than on rumors and innuendos and anecdotal studies. Well, yeah, that's, you know, this happened, and you know, my aunt took this, and it helped her. I mean, it's sort of like the thing that is well known around the world, which is if you beat a drum really hard during an eclipse, the sun will always come out. Well, yeah, that's true, but it's not cause and effect. So I think we need to get back to trusted, reliable sources, both in medical science and in just our daily news.
Oh, I couldn't agree more. Dr. K, what's the magic recipe for solving all of this? And come on.
I'll give you a little history. A year ago, I'd retired. You know, I'd retired from being medical director over at Core Granite Wellness, and man, I was walking from Portugal to Spain. And the day I ended up in Spain, everything shut down. And the worst part is it shut down coffee shops, and you can't walk without drinking coffee. So it was time for me to go home. And the ferry, I'd taken a public ferry, had shut down. I had to bribe a fisherman to take me back across the river, and then kind of hitchhiking back to Lisbon. I mean, it was a wrestle, you know. And I was planning after that to go work with Syrian refugees with the Syrian American Medical Society. I mean, what a deal. And all of a sudden came back here, and life's on a hold. And then I got this job, you know, and whoa, you know, but to be in public health in the middle of a pandemic, who wouldn't want to do that, right? Anyway, back to your question.
Yeah, you got into the real danger zone, Scott.
Oh man, getting pot shots like I never gotten in Africa. But the upshot is that Ryan mentioned 35,000 immunizations. How do you pull that off? It's not health department. It's working with folks like Alinea, the FQHCs, in the hospitals. Brian, it is. You all are doing the heavy lifting. I appreciate last weekend at your clinic that, we said, can you do childcare and the freed workers? And you did. You stepped up to the plate. And that's the best of partnerships. Parenthetically, Brian, I'd like, I met with Kimberly and Rob and Laura yesterday about a more collaborative relationship. So it'll be, kind of percolating up to you. I hope you agree to that, because that's the essence of how we are able to roll out these immunizations. Public health is used to immunizing about 1,200 people a year. We're not the major immunizers. Now we're doing over 1,500 a week. Whispering Pines, thanks to the hospital, is allocated that facility to us, and now we're ramping up next week to 300 immunizations a day, and plus consideration of some larger clinics. To answer your question, Pascal, it's a long road back, but data's not going to change people's minds. I mean, it really hadn't. You got confirmation bias, and what changes people's mind is relationships. So for me personally, I've been going out and meeting with people, some people that I vastly disagree with, but it seems like if you can build a little respect for one another, then you can have a conversation, even agree to disagree. But I've found that it's all about relationships. And so, Pascal, we wouldn't be here today unless you called us together. So I appreciate your relationship building, not only with us here, but with the community. So thanks.
That's what public service journalism is also about. It's community service. So as a reminder for our participants, if you have a question, please put it in the Q&A. And Ryan, I see that you've been already answering questions there. So anybody who has a question, please post it in the Q&A. We'll try and get to it. And what I would love from our panelists is there's some concern about possibly more variants popping up, just because the number of infections appears to go up. And if the virus, the more carriers the virus has, the greater the chances that it makes a mistake when copying itself. So, and that's how variants pop up, just to really simplify this. So we've heard now from the federal government that May 1st, everybody will be able to get a vaccine, the people who want vaccines. There's now, I get some questions again about, well, basically vaccine shopping. And I think it would be good to get your perspective on, okay, well, should I get the Moderna, the Pfizer? Johnson & Johnson's only one dose. So where do you all stand on that? Just who wants to kick that off?
The best vaccine to get is the one that you can get the soonest. There's not been any studies of all three vaccines together, so it's hard for us to recommend one over another for that situation. If people are more mobile and may not be in the same place 4 weeks later for a second dose, then it may make more sense to get the Johnson. But the way that all these clinics are being put together is that we're just trying to get this vaccine into the arms of people who want it at this point. And so it's going to be probably hard for people to do that shopping when vaccine allocation is so limited.
I agree. And there is some concern or some talk that, well, the studies show that the Johnson & Johnson is not as effective. But I think that we need to keep in mind that those studies done at different times under different circumstances. So it's like comparing apples and oranges to some extent. The Johnson & Johnson studies were done later on when there was more chance of variants and under different circumstances than the Pfizer and the Moderna vaccine. So I think they're both, all three are exceedingly efficacious, and really keep in mind the vaccines are not supposed to, we're not trying to prevent colds. We're trying to prevent serious disease, hospitalizations, and deaths. And all three of those vaccines are nearly perfect in preventing hospitalization, serious illness, and deaths.
So this would be different topic, but I think I might frame the question. Gary has what is the expectation of our getting into the red zone? So if I may, just as a non-medical person, our best expectation of getting into the red zone is that if we finally listen, please listen to all these 5 people here on the panel. Don't listen to me if you don't want to, perfectly fine, but listen to them. Keep wearing a mask, keep the social distancing, wash your hands, and if you can get vaccinated, just get vaccinated, because what's happening is we are really close. I mean, we are at right now, we missed 1 week because we were at 10.1 cases a day. Otherwise, we might have gotten into the red tier as well, and some of the restrictions would have been lifted. But right now, you know, we have the dubious honor of being one of 11 counties that's still in purple. That is really not where you want to be, and we're on the way. But again, if the case, it just doesn't go just up, so loosening restrictions, it also goes back, meaning if we have, say, 2 good weeks, and then for whatever reason, in the cases spike again, we can fall right back into the purple. And at this point, it's really, I mean, we can help our businesses by keeping the case count down, and that's up to everybody. It's not what the hospital does. It's not what Alinea or Roger, what you guys, these guys do. It's what we all do. So. But now I'm hopping off my soapbox, and I'm going to let the specialists talk.
Yeah, I would. Oh, sorry, Dr. Kellermann, did you want to go?
Ran.
Yeah, so I would note, first of all, that the state has recognized the impact of vaccines, and based on having administered a certain number of vaccines to the most vulnerable people in the state, has adjusted the state's framework so that the criteria to get into red in terms of cases per day per 100,000 is now 10 instead of 7. So that's great. But as Pascal, as you noted, we were at 10.1 last week. Then this week we were at 9.3, I believe. And so if we had been just a smidge lower last week, we would be in red as of Tuesday. As of now, if we continue to see below 10, then we'll likely go to red next week on Tuesday. So we're not there yet. We could be there next week, but we also could go the other direction, given that we are so close. I'll say just a little bit more elaboration on what the state's doing, that as we get more and more vaccines, there's going to be further loosening of that. And so the criteria for orange is also going to get looser once we hit a certain threshold, et cetera. And so it behooves us to get those numbers as low as possible if we really care about our businesses and about the health of our community. And going back to the information and where to get information, public health is an insanely complicated thing, and there's medical professionals who dedicate their lives to this, but what we need to do to get to red and get to orange is not complicated at all. We've been talking about it for the last year. We need to continue to maintain social distance, wear our masks, refrain from gatherings, don't go to places where you're exposed or exposing other people. That's the only way for us to make sure that we're positioned to move along with the rest of the state, and instead of either staying where we are or moving backwards once we are able to advance.
Yeah, we've been 17 weeks in, the purple tier, and you think, man, I feel like a caged beast. with that. And, we get asked at the health department all the time, what am I doing to move us out into the red zone, the red tier? And what? I'm not the one. It's you all. It's the community. And that's the reason forums like this is so useful. This community needs to come together to mass, maintain social distancing, hand wash, and do the things that are necessary, and particularly become immunized. I mean, it's not rocket science. This is pretty simple stuff. If we do that, we'll move through the tiers pretty quickly. And we're hoping, as our current president said, what are we going to do for Independence Day? Well, I'd like to be independent of this virus as much as we can be.
So I agree with all of that, and I would add that the light at the end of the tunnel is getting brighter and bigger, but we're not quite there yet. I think we're somewhere just under 20% of people being vaccinated in the county. Is that right, Scott and Ryan? Somewhere in that neighborhood, around 20%. So that means, there's 80% of people right now are not vaccinated, and that's going to be changing quickly in the next couple of months. So that's going to mean a lot more people are protected. And it's also going to mean, as Ryan said, the more people that are vaccinated, then the criteria for each tier will get a little looser, the more people that are vaccinated. So continue to, stay in place, keep your space and cover your face, and get vaccinated.
And I think that's so important because it is a race against the variants, like Pascal was mentioning earlier. And so if we can prevent the virus from mutating by wearing our mask and socially distancing, then we have a shot that we can get enough vaccines in people's arms and get through this. But it really does depend on all of us to do our part in that.
I'll just make one other comment. People have been very thankful and appreciative of healthcare workers generally across the county, including the hospital. And we really are well down the stream of what happens well upstream, which is folks deciding whether to wear a mask or not, or whether or not to gather with people indoors and not cover their mouths and faces. We see the after effects of that kind of behavior. So it really is the community that their behaviors have been in many cases heroic and have prevented a much worse outbreak than we may have seen. When we originally started looking at mathematical projections of what was going to happen with COVID-19, they were very alarming. And a lot of those mathematical projections were wrong because they were based on people really doing exactly what they were doing before the pandemic started. And of course, what happened was there was a lot of people changed their behaviors and did the so-called flattening of the curve that we all talked about so much about a year ago. That has worked. I mean, it could have worked better, but I will just say thank you to those of you who helped flatten the curve, because I was pretty nervous about what could happen to Sierra Nevada. I would think that every hospital CEO was very nervous about what could happen to their hospitals if things had really followed some of those early projections. Unfortunately, they did not. Some hospitals were overwhelmed. There's no question about it. Sierra Nevada did not ever have a situation where we were overwhelmed. But it's not so much because of what we did, it's mostly what the community did. And so many of you are on this call, and I really appreciate that.
So we have, I think we have two questions here in the chat. Is that, are there any plans to vaccinate homebound individuals who are eligible? So that would be the REACH team.
Indeed, it is a REACH team, and that's a special mission of public health to reach those that are more marginalized and more difficult to get out to, and that's what the REACH team does. We're hoping things get a little easier. Hoping to open up with they say into May everybody's going to be immunized, but it's kind of a problem to go into a family where you can only immunize one person or two out of a whole family, and that's not cost effective or even reasonable. But the REACH team is out not only in our community but in the Eastern County and Truckee, trying to get access to the people that are harder to get in and be immunized. And that's a special mission of public health, is to reach those people.
And can you just remind us what REACH stands for?
Go for it, Ryan.
I will have to look it up. I'm sorry. It's yeah. Allow me just a second.
It's resources and
Yeah.
Really, really excellent association. I don't know. I'm giving up.
Of clinical healthcare worker. No, it's no. Right, but Ryan will have this for us because Ryan knows everything.
It does.
And actually, let's
Resources for
see.
Equity, access, and community health.
There you go.
I found it on YubaNet.
Yes, I was just gonna pull up the story.
Reliable sources of information right there.
And something about vaccine, well, hesitancy maybe, or ignorance. A neighboring family all had COVID in November. Now they believe there is no need for them to get vaccinated. What is your take on this, and how is public health working to disabuse people of the notion that if you have it, you don't need anything?
Well,
Who
it is
wants to
true
go
for
first?
90 days. For 90 days, you're pretty well protected, it's true, but it turns out immunization hits a little different part of the immunologic cascade of the body. And so upshot is that immunizations tend to have more long-lasting immunity and more robust immunity than actually having the infection. And there are some studies that are coming out that if you had the infection and then you get immunized, you're even more protected against the possibility of a future infection. But certainly we're seeing people in whole communities, particularly down in Brazil, that had a wave of infections, thought that they were fine, and then another wave came by several months later with a variant or something, and turns out their immunizations, their immunity had waned. So having an infection does not prevent future infections after about 90 days.
And there was a study that came out yesterday, I think, from Denmark showing that that is particularly true in the older one is. So in people over 65, the amount of protection provided by previous infection was much less than in younger people. Another reason to get vaccinated, even if you've had COVID.
There are also some people who have long-lasting symptoms from COVID. Around 10% of people who've had COVID before, whether it was mild or not, may still have brain fog or heart issues or things like that. And there have been some things kind of coming out showing that vaccination can help with those long-hauling symptoms as well. So another reason to get vaccinated.
That's all good news. So we we have gone 3 minutes over time, so sorry about that. But it is well, today again it's a special date. So I would like to thank 5 of you, and I would like to thank our attendees. And any parting thoughts, any wish list, any hopes, anything to get us through the next 2 or 3 months, or no, let's call it 4, and we'll get to July 4th.
Well, Pope Francis, that dude, he rocks. But he said that immunizations and wearing masks and things like that, but particularly immunizations, are an act of charity. Is to prevent you from spreading the virus to others, and especially the ones you love. So I like to focus on the charity aspect of it. It's just being good to neighbors. And as Dr. Evans mentioned, this community has really stepped up to the plate to flatten the curve. And that proves that we are charitable. So let's focus on charity.
Well put.
Well said. I can't add to Scott's words or the Pope's.
Oh, well, I think I have one thing, because charity is great, but let's not forget that Dr. Kellermann and Dr. Evans have multiple drinks to buy for a lot of people, and hopefully very soon.
Party on.
Looking forward to it.
All right. With that, thank you, everybody. Thanks for coming, and we will have a regular update next week. But for now, please, everybody, stay safe. Wear your mask. wash your hands, social distancing, and if you can get vaccinated, please do. Thanks, everybody. Bye.
Thanks.